Tennessee back in the 70s and 80s. Patients taught me how cannabis worked for them. So I really had a privileged opportunity to learn about it 40 years ago. And for the last 20 years, I've had a clinic open specifically doing cannabis consultations. And as a GP, that includes anybody from infants to elderly or people in hospice care. So I see a wide range of people, and I've done this for a long time. I'm a doc doing this. I'm not the one you may have heard about on a TV cast saying that, oh, these are the pot docs. Yes, I'm a pot doc, but I'm a guy that's going to say, send me your records. We'll make an appointment for an hour and a half to sit down and talk about what's going on, and we'll figure out a treatment plan that hopefully will work for you, and I'll follow you up. So, like I'm a real doctor, and I enjoy what I do, and it's really rewarding to be in this because it's so exceptionally good and safe. Cannabis, as you've heard already, has been around a long time. When we look at the archaeological evidence around the world, if you're looking just for pollen that looks like cannabis pollen, it goes back 100,000 years ago into sites. And more recently, you'll see in these slides sites where these have been excavated and they're 5,000 years old or older. Here over in Japan, you have 10 to 20,000 years of age. This isn't pollen anymore. This is evidence of hemp and seeds, and cannabis was part of their culture. So this has been around a very, very long time. And if you're going to ask, well, was it used as medicine? Take a look at this comment by Herodotus out of Greece. He's a historian of Greece a couple thousand years ago. They take some hemp seeds, creep into the tent, throw the seeds, which I would have to say is the buds probably, on the hot stones. At once they begin to smoke, giving off vapor unsurpassed by any vapor bath one could find in Greece. The Scythians enjoy it so much that they howl with pleasure. That's medicine. Or is it recreational use? You know, honestly, I have a really hard time drawing a line between these issues because people use it for all kinds of reasons. They may not even know they have an anxiety disorder or a depression or whatever. They're using it because it makes them feel better, and I don't see a problem with that. Cannabis is used, thank you. So you probably understand, or maybe you don't, that cannabis is used for feed for animals. We're all uptight about whether there's a microgram of cannabis molecules in breast milk. We take babies away from their mothers. Well, here's the cows out in the cannabis field at harvest time eating these plants. The milk is going to be full of cannabinoids. And we don't fuss about it from this route of entry. But we make a big deal about it because of the war on drugs. Cannabis is also, of course, used for fiber. And cannabis is used in medicine. This is a slide I got 2 days ago. This is the Oregon CBD crop this past year. They are growing some serious CBD cannabis there. This is all about the endocannabinoid system, and I know you've heard that name, and I want you to understand it. And by the end of this hour, you're going to have a much better idea of what this means. The animal kingdom, not just us humans, the animal kingdom, probably excepting insects, have an endocannabinoid system. This is a system that's based in receptors that are on the cell surfaces and molecules that fit into those receptors called the cannabinoids, or the endocannabinoids. So we speak of it here as, what do we say, CB1, CB2, TRPV1. There were 6 that were mentioned in Blake's slide set. There are that many and more, and we'll talk more about this as we go along. There's also the proteins that make these receptors. So these receptors, I'll show you some slides about what happens as they're produced and they come into the cell in order to do many, many things that keep us in balance. It's all about homeostasis. This is what this system is about, is to bring us back into balance. So the plant cannabinoids, or the phytocannabinoids, are very, very unique in cannabis. There are, if there is cannabinoids in a few other plants on Earth, they're in very small quantities. But in cannabis, it's rich in cannabinoids, and this is very exceptional. So the phytocannabinoids, these plant cannabinoids, augment this natural system that's in our body. And for that reason, help bring us back into control, into homeostasis. They help us to eat and to sleep and to relax. and to forget in a good kind of way. It's very important for PTSD to have a healthy endocannabinoid system, and to protect us in a variety of ways. Killing cancer cells, bringing us back into helping us take care of abnormal cells in our body, helping with pain management. These are cannabinoid roles. So here's just an image to have you understand all the way down to these little simple hydra on the upper left, and the sea squirts, and the amphibians, and the reptiles, and the mammals. We all have a natural endocannabinoid system, and it's working just every time you have the impulse. It's time to eat, it's time to sleep. This is your endocannabinoid system driving you into behaviors that are good for you. So again, this is why cannabis is so comforting, is it's doing that for us. It's augmenting this natural system. Now, if we take THC or a cannabinoid and label it radioactively and put it into the body, it will go to these places in the brain. These reds and orange and yellow zones in the brain are very rich in the CB1 cannabinoid receptors. There they are. We can see them, and we'll talk about these receptors as we go along. In the rest of the body, if we inject them into the body, they start to show up in your liver right off. You see the big red organ there on the right, or on the left of your screen. That's your liver. And then they show up in the skeleton, where there's a lot of cannabinoid receptors, and the liver, and the spleen, and the gut, and so forth. They're rich in our organs. And so here's a list of some of the locations of the CB1 and the CB2 receptors. Two receptors that are a little bit different. The CB1s are primarily in the nervous system, in the brain, and in the nerves that go around the body. And the CB2s, where they're anchored in the immune system. So in the immune system, they're responsible for scouting around and seeing what's going on in our body. The macrophages, monocytes, T cells, B cells, lymphocytes. These are scouting in our body for problems. And if they come across a cell that shouldn't be, it isn't functioning properly, maybe it's a cancer cell, maybe it's just a cell that's not working properly, the cannabinoid system is responsible for breaking down that cell, causing it to die, and cleaning up our bodies. So this is a role of our natural endocannabinoid system. So these receptors in the nervous system and in the immune system are rich throughout our bodies. The kinds of things that they're doing there, this is a list. It's not even complete, but it gives you a pretty good idea of what kinds of things the endocannabinoid system and the cannabinoids are doing in our body, starting with pain relief on the upper left and the long list. I need not read them, but again, if you want to see a list and get on our list at the Society of Cannabis Clinicians table, I'll share these things with you. As a clinician, as a physician, this is what it means to me. This is in rank order of the conditions that I'm seeing in my practice, starting with pain, followed by cancer and mental disorders of all kinds, gastrointestinal disorders of all kinds, insomnia, migraines, harm reduction, and here, getting off of the drugs that people so often end up on. Cannabis can often replace these drugs, so I actually code for it in my diagnosis with the patient if they're on polypharmacy. So this is part of our goal, is get people established on cannabis, getting them feel comfortable with it, and then tapering off of these other medicines that in many cases are dangerous and harmful drugs. Spastic disorders, autoimmune disorders, neurodegenerative disorders, glaucoma, skin diseases, and so forth. Here's epilepsy, autism, Tourette's, ADD, and dystonias. These are problems that I'm seeing in a lot of kids these days. And in California, as long as the doctor gives the recommendation, we treat the kids and babies as well when they have these serious problems. Dementia, AIDS, and other infections. I should have included actually PTSD as a specific category because it certainly is important as one of those entities in my practice, which I lump under the mental disorders. This is ICD-10 codes. This is a way to code in our records. So any doctors here, you know what I'm talking about. But otherwise, these are the way I code for my patients so they can't come in with a particular problem. I make a note of it. And if I go to search, I can look up and see, okay, I've got 73 people with prostate cancer, and I have 60 people with multiple sclerosis, and whatever the condition might be, I can search for it in my records that way. Here's those endocannabinoids and receptors we talked about a little bit ago. There are actually more than 6 in this list. And the endocannabinoids are listed below. We speak of a group of endocannabinoids. This is a much more broad list, and I didn't really intend for you to read it. Some of them are precursors to cannabinoids, some of them are cannabinoids, endocannabinoids, and they're players in the way that we feel. Dr. Meshulam's name was mentioned a little bit ago. He believes that this milieu of these molecules is actually what determines our personality. Very interesting thought as to how our brains are working. So this whole area of cannabinoid science has led us into discoveries that we had no idea about as far as medicine, and I'll show you much more of that as we go along. One of the more important roles is in being kind of like the brakes in our nervous system. So here's a typical neurotransmission. In this case, glutamate is the neurotransmitter. And if there's a weak signal, there's not enough glutamate to transmit a signal to the next cell below, which is this postsynaptic cell. If we turn up the signal and have a strong signal, there's a lot of glutamate released. It floods into this cleft between the 2 nerves, and on it goes to the receptor where it propagates the electrical signal to the next nerve. This is the way our brains work, not only with glutamate, but with a whole set of natural neurotransmitters. And you heard another one earlier. Dopamine is a neurotransmitter. Serotonin is a neurotransmitter. So these are natural substances that transmit signals in our brain. And the cannabinoids are working this way, right here. The cannabinoids are produced on the postsynaptic cell, the bottom cell. When the signal starts to get strong, it's making a lot of activity to this nerve transmission. If you play with nerves in a laboratory and keep driving them over and over and over and over again, you'll kill them. So the endocannabinoid system is there to protect the nerves. And as you saw in the patent of the US government, it is a neuroprotectant. So the cannabinoids, these natural endocannabinoids, cross the cleft in the opposite direction of the neurotransmission, hit the CD1 receptor in the case of the nerve cells, and when it's activated, it stops producing and releasing the glutamate. It's the brakes on the system. It's protecting the cells. So too much anxiety, it turns it down. Too much pain, it turns it down. It's working all the time to do these roles. It's not only in this excitatory neurotransmitter, glutamate, it's also there in the, this one, let's see, right? This one is the inhibitory neurotransmitter GABA. So it doesn't have to be an excitatory neuron, it can be an inhibitory neuron. It's a little more detailed than you probably need to know. In the immune system, we know that the cannabinoids work as neuromodulators. I'm actually seeing that I'm missing my top line and bottom line on slides. I don't know. Well, this slide's okay over here. Take it for what it is. This is what we have today. So it's abundantly evident that the cannabinoids are working to modulate the way our immune system works. We don't want the immune system to trigger all the time. You get a puff of smoke in your face, you don't want to start making antibodies against the smoke. Your immune system is working in a way to modulate when we do have an immune response. The cannabinoids are responsible for that, so we don't waste energy. They are very helpful in the host versus graft response. So patients of mine that have had transplants, kidney transplants, or any kind of transplants, I find for decades now that they come back and say, the docs are really happy, my kidney's doing great, I don't need much of these immune modulating drugs because I'm using cannabis. And in this bottom paragraph, this really supports what we have seen in the AIDS community clinically, and that is to say that simian monkeys, when infected with an AIDS-like virus, the simian immunodeficiency virus, they are then divided in half. Some of them get a THC injection every day. I'm sure they enjoyed it. The other monkeys didn't get the injection. The ones that got the injection every day, it attenuated viral load and tissue inflammation, significantly reducing the morbidity and the mortality of the infected macaque monkeys. It works. It makes a difference. It also reduces nausea and vomiting, and you can take the AIDS medicines, which are often very hard to handle. Now, this is a picture of what these receptors are like. They're produced down inside the cell. We're running amino acids into a chain, and that chain eventually clumps, and that clump is the receptor. It migrates from inside the cell up to the cell membrane, up to the cell surface, and there it's ready for business. Sorry. This yellow clump is the clump, that's the receptor. The cannabinoids fit into the receptor and activate it. And when that activation occurs, all of those physiologic things happen. Now, we know from the basic science that if we alter just one of the dots, one of the blue dots or green dots in this chain, it will affect the way that receptor works. Just like a key and a socket. If that tumbler isn't just right, it doesn't work very well, or maybe it works but not as well. Now we're talking about a diminished functionality because the receptor is a wee bit different. We see this clinically, and we call them endocannabinoid deficiency syndromes. We can see the genes. We look at the genetics of the receptor, and we can see what we call polymorphisms, different forms of the endocannabinoid receptor genes. Certain diseases even exist. So this is the next 2 pages are actually some of these diseases or conditions that are considered to be or implicated as endocannabinoid deficiencies. I don't intend to read the list, but look through it and you'll see things that you'll go, oh yeah, we don't know why fibromyalgia even exists, but here's the possibility. People may have, in fact, an endocannabinoid deficiency, making them prone to this particular condition. And this list as well. There's the seizure disorders. A Japanese researcher did a study on happiness. It was very interesting. He just tested them. And those that had a real happy outlook on life, he looked at their cannabinoid receptor genes, and sure enough, they had a similar polymorphism of the cannabinoid receptor gene. So in the plant, we have this treasure trove of molecules that are medically important. We talk about CBD, we talk about THC, but that's just the tip of the iceberg. These little trichomes, these little oil globules are rich in these molecules. And they're not only the cannabinoids, they're all there, but they're also the terpenes and other molecules that are pharmacologically active. So as we do the research, we're learning so much more about it just in recent months and years. This has been very exciting. This evidence is out of Dr. David Miri's laboratory at Technion Cancer Institute in Haifa, Israel, and he's now saying that we have between 100 and 144 different cannabinoids in the cannabis plant. Depending on where it's grown and the strain that it is, it's going to have quite a vast range of cannabinoids. They're just part of the story, as I was saying before. And I'd like to show this slide to give you an idea, because you've got CBD, and I'm delighted for that. And it probably isn't pure CBD. It may be from the hemp plant, so the hemp plant is going to have many of these other molecules there, maybe 100 of them, but they're in very trace amounts. So what this is talking about in this slide, an animal was injured, the paw was burned, and we looked at the swelling in the paw and the pain that the animal was experiencing. So in the two graphs on the left, she used a CBD only. And what we found is that in the paw swelling on the top left, the swelling came down to that dark bar in the middle, and then as they gave more CBD, the effect disappeared. And similarly below, as she gave more CBD and measured the pain response for the animal, there was a sweet spot where the pain was relieved the most, and as she went up on dose, the pain disappeared, or the pain response, the pain benefit disappeared. So single molecule CBD is known to have a biphasic response, up and then down. It's not really what you want, and it makes it a little complicated as to what the best dose is. It's not that easy to know. Clinically, do we see this? Well, it's hard to tell. Honestly, it's hard to tell. You're going to get an effect, but are you optimizing the effect? That's an unknown. On the right side is CBD grown as a whole plant extract. So it's one of the strains that you may very well have here in your CBD dispensaries. So what we see now is a linear curve, meaning the paw thickness comes down and down and down with the greater dose. And on the pain control, the bigger the dose, the bigger the effect. So the whole plant works a lot better than the single molecule. And I'm going to keep emphasizing that as I go along with these slides. Oh, that one crumpled. The point of these are this. Dr. Costa showed years ago that THC reduced pain, CBD reduced pain. You put the two together and you have a much better pain reliever. And on the bottom study, Markle and McAllister, what they showed a few years ago was you can use THC and CBD to kill cancer cells. In this case, the column on the left is just a control. The next column is adding that much THC, 0.17 micromolars per liter, and it killed that many of the cancer cells. Now, if you gave a big dose of THC, it would kill them all. Or if you gave a very, very low dose, it wouldn't be noticeable. But this is a sweet spot where we see it actually dropping the viability of the cells. On the next column, the right-hand black column, that's a CBD response to a very low dose of CBD. And you put the two together, and here is the response down on the far right. So they work much better together, again, than they do alone. This is the synergy of the cannabinoids that we're seeing. And the next slide is just going up on dose. He more or less triples the dose of the THC and he doubles the dose of the CBD, and now you can hardly grow these cells at all with that combination of the two. So once again, the theme here is cannabinoids work better together than they do individually. This was played out in a very interesting finding in Israel a couple years ago. They're treating kids with autism with 100 milligrams 3 times a day of CBD, whole plant extract. And everybody's doing better. They come in with violent behavior, they're aggressive, they're unhappy, they're agitated, they're isolated. They give them the CBD and everything begins to soften up and look better. Well, suddenly, about a year ago, November, they lost control of these kids, and the caregiver said, "What happened? It's not working." Well, the initial response was, "Well, it's the same medicine." But they took it to Dr. Mary's laboratory to check it out, to see what happened. Again, this is behavior. So they come in with bad behaviors up here at the 5, they come down to this 2 level, and then when they changed strains, the behavior got very bad again, and they had to go back to the original strain. This is what he learned in the laboratory. Compound 266, the one on the left, worked. Compound 267 is the strain that didn't work. The THC-A and the CBD-A, those molecules where the big arrows are, here and here, were virtually identical. So they thought it was the same strain. But it wasn't. You can look at these other blocks to see that the concentration of these other cannabinoids, minor cannabinoids you probably have never heard the name of, were quite different. Is one of them responsible for the difference? Is it the entourage of them that's different? We don't know. But we do know that the original strain worked. They went back to the original strain, and the kids came back under control. Similarly, in killing cancer cells, we have a control bar on the left, and then we have 3 cancers going across here. The top is colon cancer, breast cancer, prostate cancer, and then non-cancerous cells. And to those, we're adding 3 different strains of extracts of cannabis. The column in from DMSO is extract 1, which is a high THC strain of cannabis. The next one is a high CBD, is another high CBD strain of cannabis. Well, look at the differences. The THC strain and the first of the CBD strains are very similar. They killed almost all of the colon cells, almost all of the breast cancer cells, but they didn't touch the prostate cells. And then you got to the other CBD-rich strain, and it was the opposite. It didn't do much at all for the colon cancer, the breast cancer, but it killed most of the prostate cancer cells. So what does this lead us to believe? We don't know what we're talking about. Trying to figure this out. So here's THC and CBD. The subtleties in these molecules are minimal. There is a hydrogen atom that comes off of this point on the molecule and goes over the oxygen, and that is CBD. This is an enzyme process that happens in the plant. You can't do that by heating it or adding this or that to it. It's a process that the plant is developed by its own genetics. So they're pretty stable with these ratios of cannabinoids that they have in them. THCV happens to be another plant cannabinoid, and I show that here because THCV is a cannabinoid that in low concentrations is a blocker of the receptor. Gets into the receptor, doesn't activate it, so it's like a blocker. It's like a plug in the hole. And you notice the difference between THC and THCV